Thank you, Wen. I'm Brian Mustanski, Director of the Third Coast Center for AIDS Research in Chicago. You might not have known that the country had a third coast, but we do. It's the Great Lakes, and we proudly represent them and are proud to represent the Midwest at this meeting. In addition to directing the Third Coast Center for AIDS Research, I also direct the Implementation Science Coordination Initiative, which I'm happy to very briefly tell you a little bit about and also share with you a little bit of information about some of the projects that NIH has supported over the last 10 years. I'm speaking on behalf of my fabulous team that's with me here. Many of us are here. Feel free to reach out and say hi to us at the meeting. We're happy to tell you about the resources and tools that we have available, and so feel free to come up and say hi. In addition to the Implementation Science Coordination initiative that's based in Chicago, there are also 8 hubs that are currently funded to also provide support to EHE-funded projects. And just to kind of give you a sense of what ISCI does, what the hubs do, ISCI is really charged with coordinating the collection of data from the NIH-funded EHE projects. We also do a lot around dissemination, creating communities of practice for people to share knowledge, learning as it's happening in these academic community partnerships. We have a newsletter that has, I think, nearly 1,000 subscribers at this point from government, health departments, universities. We host a webinar series, and then we also do a lot around dissemination of knowledge as it's occurring in the context of these projects. So a special issue of JADES. We create a lot of tools that I'm going to just mention very briefly at the end. And then we have these IS consultation hubs that are assigned to a group of projects that are doing work on a similar topic and really working with them, giving them support, and also creating opportunities for them to share what they're learning. So if there's a group of projects doing work on PrEP in Black women, they're able to kind of be talking to each other in real time about what they're learning in that work. There have been 248 EHE supplement projects that have been funded by NIH through the Centers for AIDS Research and ARC to date, and you can see the projects over the years. One of the things I want to mention is the data that I'm going to be sharing in a second is data that's been provided to us by the project. And if you've led a project, you've probably gotten a lot of emails from us asking you to fill out surveys, provide us information about what you're doing. And you might be wondering, well, why are they collecting all of this data? What's the point in capturing all this data about the projects? And I want to say 2 things about that. One is, you'll see in a second, some of what we're learning about the projects. Who's doing what? Where are these projects happening? What populations are they working with? What are they learning? And by capturing this information on projects and sharing it publicly, there's a lot of opportunities for people to find each other, work together. We also have an opportunity to look for gaps in the portfolio. What are populations that haven't been addressed sufficiently, or regions or settings? We also really do a lot of work on standardizing the data that people collect so that as much as possible, people are looking at the same kind of outcomes across their projects. And why is that important? Why do we care? Well, EHE has some pretty ambitious goals. And one of the things we know is that when projects that are studying very different topics look at the outcomes in the same way, that allows us to compare findings across projects. That creates more opportunities for generalizable knowledge. How did this work in one setting do and compare to a different approach in a similar setting? And that allows us to move more quickly. We know science can move more quickly when people have comparable outcomes, and there's also more opportunity for it to move into practice more quickly as well. So now I'm going to share with you a little bit of the information that we've collected from these projects over the years. I'll give a little description of the types of projects. All of this information is available in a public dashboard that's available on the HIVImpsci.org website. You can also access it through this QR code. You can go into this dashboard and you can look at the projects by region, by state. You can filter them and say, I'm really interested in the projects doing work with Native communities or in pharmacies around PrEP, around testing, and find the projects that are doing work in that area. And then we do a lot around bringing those projects together as well to kind of share what they're learning as well. So these are the projects by EHE Pillar over the years of the initiative. And some of the things that you might observe in this pattern is that prevention has been the most addressed pillar in the NIH-funded supplements to date, followed by treatment. And testing and respond are have had fewer projects that exclusively had that focus. But one thing I'll mention is that many of these projects address multiple pillars. So there's not really a project that's just focused on testing that's not also looking at linkage to care or looking at PrEP services. So there's a lot of overlap across the projects. We've talked a lot, and in the last session, we heard a lot from community about what populations are being represented in this work. And you can see that when we look at these 248 projects, and actually 182 have reported data on which populations they're working with, we see that it really does reflect the priority populations in terms of the HIV epidemic in the United States, with Black or African American communities being the most represented, and then men who have sex with men, Latino populations, transgender populations, cisgender women. Somebody in the last session had asked about work involving the justice, people that are intersecting with the justice system, and you can see there's been 11 projects focused on work with the justice system. So all of this data is publicly available in the dashboard, and you can go and look at what kinds of projects have been done so far. We also are interested in who these academic community partnerships are working with. What are the community organizations that have been represented in these projects to date? You can see community-based organizations is the largest, with 130 NIH supplements focused on academic partnerships with community-based organizations, health departments with 93, and federally qualified health centers with 64. Again, all of this information is publicly available. We also do our best to capture data on the outcomes of these projects. So as we do follow-up surveys with projects over time, we ask them, have you published your data? Have you gone on to give presentations, to get additional funding to implement the findings of the project? And we can see that there's been 22 publications. Now, one of the things I want to say about that is really an underestimate, because what we don't do is keep surveying projects forever. You know, we don't go back to the 2019 projects for the rest of their life and ask them about every publication they've had. So one of the things that I'd like to make a pitch to is, if you are involved in an EHE project and you have publications, you have findings that are really interesting, compelling, that you would like to help spread the word about, please reach out to us. Because one of the things we do is we actually interview the project teams and ask them, what have you learned through this work that you think other communities should be learning about and understanding as well? And so if you have a finding, you've been doing something really great in your community, please reach out to us, and we'll have our communication coordinator talk to your team. We'll create an article about it that's really with infographics, really designed for dissemination. And these are examples of 2 of them. In wrapping up, I also just want to briefly say that we have a lot of tools and resources on the HIVIMSCI.org website. We have a systematic review dashboard where you can look at the literature on PrEP determinants, strategies, adjunctive interventions. We have an interactive implementation research logic model builder for you. We have resources for grant applications. We have outcomes that you should be thinking about in your work. We're developing a compendium of effective strategies. I know that's something that was mentioned earlier. Is there a compendium of strategies? We're working on developing that in the near future. So check out our website, make use of our resources. They're here for you. We also have 2 training programs that you might be interested in. The applications will be opening again this fall. One is for community-based practitioners who are interested in learning more about implementation science and how to use it to advance the work they're doing in the community. And one is for academics as well, to learn more about academic community partnerships. If you're not already doing it, I encourage you to sign up for our newsletter. It's only, I think, every 2 weeks, so we're not spamming you a ton, but there's lots of great resources in there, new updates about funding opportunities, featured work that's coming out through these academic community partnerships. So you can sign up at that QR code. And with that, I'm going to introduce the next moderator, Robin Lanzi, who is going to moderate the next session. Thank you.